3, go.
Abdominoplasty is a procedure that flattens your abdomen by removing extra fat and skin and tightening muscles in your abdomen wall. The surgical procedure is also known as a tummy tuck. Examples of when this procedure would be necessary is abdominoplasty is particularly useful in improving the appearance of people who have lost a great deal of weight or who suffer from laxity of abdominal skin following pregnancy. The surgical position would be supine with slight flex at the hips, and safety precautions is frequently tumescent anesthetic solution will be added to minimize bleeding, reduce postoperative discomfort, and aid in dissection. Prep boundaries for this procedure is pubic hair should be removed beginning at the side of low abdominal transverse incision. Prep should extend to the nipple line to mid-thighs and bilaterally as far as possible. Drapes, examples of drapes that are used is draping is such that the entire abdomen, lower costal margins, upper thighs, and both interior iliac spines are exposed. The entire abdomen outlined with 4 towels and a laparotomy drape.
The anatomy involved is the abdomen and the abdominal muscles. A brief description of the procedure is the surgeon makes the lower transverse abdominal incision across both inguinal areas laterally and superior border of the mons pubis and the midline down to the fascia. A large flap of skin and subcutaneous tissue is elevated away from the fascia of the interior abdominal wall. The umbilicus is circumscribed and left in its normal position. The surgeon elevates the abdominal flap until the xiphoid pro 121. What? That's process. The xiphoid process of the sternum and the lower costal margins are reached. If the diastasis of the rectus abdominis fascia is present, the surgeon plicates it with suture from the xiphoid process to the mons pubis. The flap of the abdominal skin and subcutaneous tissue is pulled inferiorly to access tissue is excised. A small incision is made in the midline of the flap to accommodate the umbilicus, which is then sutured peripherally to the flap. Drains are inserted, followed by the closure of the lower abdominal incision in layers. Postoperatively, the patient is placed in the hospital bed in high Fowler's position. 3 examples of equipment and supplies that may be needed are fibrotropic retractor set, closed wound drain systems, or abdominal girdles. Risk factors for this procedure can include postoperative SSIs, hemorrhages, severe edema, and less than desired cosmetic results. Question for our classmates is going to be, what position is the patient in?